In Chapter 4, we examine the muscular system. The objectives are listed in the module. Muscles are a dynamic system. Muscles hold the body up and are responsible for movement. They generate most of the heat that keeps us warm. Muscles help with digestion, circulation, and are involved in other systems by moving fluid through ducts and tubes. Which of the following is not a function of the muscular system? Muscles cannot push bones. Fun facts about the musculoskeletal system. It's two systems in one. Muscles provide the body with form, stability, and movement. There are more than 600 muscles, and they make up 40 to 45% of our weight. Muscle fibers are long, thin cells that combine to create groups of fibers that are bound together by connective tissue called fascia. The fascia surrounds, separates, or binds the muscles or groups of muscles that allow for movement. Myo is muscle, and fasci is fascia, and all means pertaining to. So myofascial means pertaining to muscle and fascia, or fascia, however you want to pronounce it. Tendons are fibrous connective tissue, not very stretchy and very dense. It has to be in order to connect the muscle to the bone. Types of tendons we commonly hear about are patellar tendon of the kneecap, the Achilles tendon that attaches the calf muscle to the heel bone. Here's a diagram of where you can see where the tendon is in relation to the muscle and the bone. There are three types of muscle. Skeletal, that attaches to bones and makes movement possible. It's made up of voluntary, striated muscle. Smooth muscle is associated with the walls of internal organs, and it is involved in involuntary muscle movement. Myocardial, let's break that down. Myo is muscle, cardi is heart, and all is pertaining to. So pertaining to the muscle of the heart. The constant contraction and relaxation of the heart is what our heartbeat is. The appearance is striated, like skeletal, but it's involuntary smooth muscle, also known as the myocardium or cardiac muscle. Which muscles are voluntary? Skeletal. Remember, cardiac and smooth muscle are involuntary. You don't have to think about making your heart beat. It just happens, hopefully. So if you're not doing it voluntarily, it's involuntary. Muscle movements occur when an impulse is sent by a motor nerve to stimulate that muscle, which causes it to contract. When the stimulation stops, the muscle relaxes. Motor nerves control voluntary muscle contractions. Neuro is nerve, mus is muscle, and R means pertaining to. So say it with me, neuromuscular means pertaining to the nerve and muscle. Antagonistic muscle pairs are those sets of muscles that work in opposite ways. So when one contracts, the other is relaxed. Contraction is when the muscle tightens up and becomes shorter and thicker. Relaxation is when the muscle returns to its original state and becomes thinner and longer. The example here is the triceps on the posterior aspect of the arm and the biceps on the anterior aspect of the arm. Think of what happens when you do a bicep curl or a tricep kickback for you gym rats or weightlifters. Another pair of opposite movements is abduction and adduction. Abduction is the movement of the arm or leg away from the body, and an abductor is the muscle that makes that movement happen. Adduction is the movement of the arm or leg towards the body, and an adductor is the muscle that makes that movement happen. Another opposite muscle movement is flexion and extension. When you flex your bicep, and extend when you lay your arm out. Hyperextension is overextension of the limb beyond its normal limits, like way here. Elevation is raising or lifting, so a levator muscle allows a body part to raise or lift up. Depression is lowering, so a depressor lowers the body part, like when we frown. Rotation and circumduction are also opposites. Rotation is the circular movement that occurs around a joint, like a shoulder. So a rotator muscle is responsible for rotation. Circumduction is that movement at the far end of the extremity. Another set of opposing movements is supination, rotating the extremity so the palm or the sole of the foot is turned forward or upward. Pronation is rotating so the palm or the sole is turned down or back. So if you carry a bowl of soup, your palm is up, supination. Dorsiflexion is when you point the toes up towards the dorsal side of the foot. Plantar flexion is when you point your toes down towards the plantar aspect of the foot on the bottom. Which isn't a movement? Well, we just talked about the first three. Force. Muscles are named in different ways, so you can always determine something about that muscle by their name. One way muscles are named by when they started and where they ended up. Origin is where the muscle starts. Generally, they are located near the midline of the body or the less movable part. Insertion is where the muscle attaches to, and it's generally distal. Remember, distant from the midline. Muscles are also named by what action they make. A flexor or extender, like flexor carpi and extensor carpi, which are responsible for the bending, flexing, and straightening, extending of the wrist. Muscles are also named for their location in the body. For example, the pectoralis major is in the chest. Pect is the root. One of several that means chest. O is the combining form, and al means pertaining to, so the major muscle pertaining to the chest. Vastus lateralis, vastus means huge, lateralis, remember lateral means towards the outside of the body, so a huge muscle towards the outside of the body. Similar deduction with the vastus medialis, but with medial. What does that mean? Correct. Medial is towards the midline of the body. Muscles can also be named for the direction that the fibers lie. Oblique is a slanted muscle, like the oblique muscles of your abdomen. Rectus is like erect, straight up and down, like the rectus abdominis. Those are the muscles that run straight up and down in front of your abdomen. Sphincter is like a ring, so it opens and closes by relaxing open and allowing things to pass, and by constricting and stopping things from moving through, like your anal sphincter, which comes in handy when you're having diarrhea. Transverse muscles lie horizontally. The names of the muscles can tell you the number of divisions it has, like biceps, brachii. Bi means 2. Triceps, brachii. Tri means 3. The singular and plural of these muscles are the same. Muscles can also be named for their size or shape. Examples are the gluteus maximus, the largest muscle of the butt, the deltoid, which is named after the Greek word for triangle. The muscle is triangular in shape. Fun facts: the hamstrings are named for the way a butcher hangs a slaughtered pig, by the hamstrings. Gross. How are muscles named? All of the above. So many ways. The muscles of the head include the frontalis. Clue, it's in the front of the head, the forehead. What does the muscle do in the forehead? Moves those eyebrows. The temporalis moves the mandible, the lower jaw. The masseter is one of the strongest muscles in the body. Why? It's our chewing muscle. How else are we supposed to eat that beef jerky or Laffy Taffy? We just talked about some of the muscles of the trunk, the pectoralis, major, internal and external obliques, and the rectus and transverse abdominis. Muscles of the shoulder and arm, we also talked about briefly. The deltoid, shaped like a triangle, or the Greek letter delta. The trapezius moves the head and shoulder blade, and the biceps in the anterior upper arm, and the triceps in the posterior upper arm. Muscles of the legs are the rectus femoris. Remember we talked about that before? Rectus is straight up and down on the femur. Keeps that femur in that ball and joint socket. See how it all relates? Quadriceps femoris is made of how many? 4 muscles, because quad is 4. Hamstrings, we already talked about the gross origins of that name. And the gastrocnemius is the calf muscle. That is responsible for knee and foot flexion. Gastro refers to stomach, and that's because the calf looks like the stomach in the way it bulges out. Well, like my stomach. I don't know about yours. Here are medical specialties that focus on the muscular system. Who works with paralyzed patients? Neurologist, but honestly, they all can work with paralyzed patients. So common conditions or disorders or pathology of fiber, fascia, or tendons are fasciitis. Fascia means fascia, and itis is inflammation, so inflammation of a fascia or fascia. I'm going to pronounce it both ways. Fibromyalgia is chronic fatigue and muscle bone pain. 2 root words here. Fiber is fiber, my is muscle, and algia is pain. Now did it need a combining form? No, because algia has a vowel, so you don't need to add another one. Apply those rules when looking at these words. As time goes by, you'll see how remembering the basic rules will make all the other chapters make sense and be easier. Pathology of the muscles are adhesions or scar tissue that hold structures together in an abnormal way. Atrophy is weakness or wearing away of tissue or structures. Cachexia is wasting away due to a massive weight and muscle mass loss. Think of patients with advanced AIDS or cancer. A hernia is a tissue that pops through an area of a weakened muscle, like an inguinal hernia in the groin. Myalgia is muscle pain. We just covered it. Polymyositis, let's break that down. Poly means many. Myo is muscle, and itis is inflammation. So inflammation of many muscles. Rhabdomyolysis is the death of muscle fibers. As they die off, they release their components into the bloodstream. This can overwhelm the kidneys, leading to kidney failure. Sarcopenia is loss of muscle mass and strength. That's a natural part of aging. Conditions of muscle tone include atonic, so A means without, ton means tone, and ic means pertaining to, so no tone. Dystonia is dysfunctional movement or tone, and hypotonia is decreased. Hypo is decreased, tone is tone, so decreased tone. Pathology of muscle movement are ataxia, which is without coordination for voluntary muscle movement. Contracture is a permanent tightening of the muscles, tendons, ligaments, or skin. This is where normally elastic tissue is replaced by non-flexible fibrous tissue, which does not allow for movement. Intermittent claudication pain that occurs during exercise and movement, but is relieved by rest. Spasm is a sudden involuntary contraction of muscles, like a tick in your eye. Myoclonus is quick involuntary muscle movement, like nap jerk when you get right before you fall asleep, or it could signal a neurological disorder. Singultus is hiccups. Wow your friends and family with that one. Cramps, we all know what that is. Torticollis is that stiff neck that happens when you sleep wrong and your head only wants to point in one direction. More conditions of the muscle are bradykinesia. So brady is slow, so very slow movement. Dyskinesia, dys is functional, so abnormal movement, very jerky or uncoordinated. Hyperkinesia, hyper is increased function or activity. Myasthenia gravis is an autoimmune disorder that is an umbrella diagnosis for more than 30 genetic diseases. There are also disorders from overuse, like overuse tendonitis or trigger finger, all related to inflammation. Compartment syndrome isn't really a part of this group, but it does cause muscle movement constriction because of swelling in that compartment that surrounds the muscles. There is myofascial pain syndrome, characterized by chronic pain through the fascia and the muscles of the body. There are also rotator cuff injuries that cause other pathologies such as impingement syndrome, or you can have a tear of the rotator cuff. Carpal tunnel syndrome is also a repetitive stress disorder. Remember that tunnel where all the nerves and tendons pass through from the wrist to the hand? With overuse, that tissue becomes inflamed, which causes swelling and pressure on the nerves and muscles. A ganglion cyst is a benign, fluid-filled sac that's usually on the surface of the wrist or the hand. It looks like a lump, generally painless. There's epicondylitis, which is inflammation in the elbow, either lateral, away from the midline, which is tennis elbow, or medial, towards the midline, which is golfer's elbow. Ankle and foot problems can be a heel spur, which is a calcium deposit, plantar fasciitis, the inflammation of the plantar fascia. Morton's neuroma is an inflamed nerve on the ball of the foot causing pain. Posterior tibial tendon dysfunction, PTTD, is a fallen arch. These sports injuries, and even if you don't play sports, are the ones you are most familiar with: sprain, strain, etc. You should look at each carefully because there is a very distinct difference in between each condition. Spinal cord injuries can be incomplete or complete. That's self-explanatory. The level at which the injury occurs, remember C1 to 7 is the neck, T1 to 12 is the chest or thorax, and L1 to 5 is lumbar, will tell us what kind of effect it will have on the body. There are different descriptors of paralysis. Myoparesis is weakness or slight paralysis of what? My is muscle, so paralysis of the muscle. There's hemiparesis, which is one-sided like a stroke. Hemi is half. That is different from hemiplegia, which is total paralysis of one side. Paraplegia is partial paralysis. Think para as a para like both legs. Quadriplegia is a total paralysis of all 4 limbs. Which one is a paralysis? What are the descriptors for paralysis? Either plegia or paresis. So if you look for any answer with that in it, you'll get it right. How do we diagnose conditions of the muscular system? Deep tendon reflexes, like when the provider uses that little rubber tomahawk and taps on your elbow or your knee to elicit movement. Range of motion, when your provider has you move your affected joints to see what the limitation may be or what kind of pain is elicited. There's an EMG that measures the electrical activity in the muscle. You can also biopsy the muscle and send it off to the pathologist for evaluation. Remember pathologists from chapter 2? Here are some common medications: antispasmodics, steroids, and muscle relaxants. There's drugs that block nerves and muscles that cause paralysis on purpose, like those used for anesthesia, where not moving is really important. Plasma therapy and injections of substances in the joints to help provide additional cushion in the joints. Ergonomics that help us to work so that we don't hurt ourselves while doing our jobs. There's physical and occupational therapy. There's myofascial release, which is a type of massage therapy. For the tendons, there's tenodesis, which is the suturing of the tendon to a bone, or tenolysis, which is the release of the tendon from adhesions or scar tissue. A tenotomy is a cutting of a tendon to release or lengthen a tendon. For muscles, there is myography, which is a suturing of the muscles, and a myotomy, which is a surgical incision into the muscle. Here are some associated abbreviations that are related to the muscular system. They are listed in Table 4.1 in your e-text. What's the correct spelling for pain in the muscle? Well, what's the suffix for pain? And what's the root for muscle? Myalgia. My is muscle, algia is pain. Do you need another vowel in there if there already is one? Nope. What is an ADL? Activities of daily living. Which of the terms has a combining form that means movement? Kine or kinus means movement, so anything with that in it would be hyperkinesia.